Hey everyone, my name is Ritvik Avula, and today I'll be talking about how artificial intelligence and brainwave recordings, also known as EEG, are currently working together to predict seizures in epilepsy patients and its growing potential in underserved parts of the world. But first, let me start by telling you a little bit about myself. I'm a rising senior at Rick High School located in Frisco, Texas, and I'm especially interested in how we can use both neuroscience and technology to solve problems that affect millions of people around the globe, especially those that are overlooked. Outside of school, I've gone to explore my passion of neurology through my student internship at UT Southwestern under the NOC lab, currently researching glioblastoma, a brain cancer with a 5% survival rate. Also, I got to attend the neurology grand rounds across campus and various lab meetings, those including the renowned scientist Dr. Lewis Cantley. Now, let's begin with the actual content, starting with what epilepsy actually is. Epilepsy is a chronic brain disorder that causes recurrent seizures, basically sudden surges of abnormal electrical activity in the brain. And these seizures can vary from brief staring spells to full body convulsions, and they often strike without any warning whatsoever. According to the Mayo Clinic, epilepsy affects over 50 million people worldwide, making it one of the most common neurological disorders globally. Yet, in middle and low income countries, nearly 70% of people with epilepsy don't receive the treatment they need. One of the biggest challenges these patients face is unpredictability. Not knowing when the next seizure may strike creates constant anxiety, and that's where seizure prediction comes in. This map shows the global prevalence of epilepsy measured by the number of cases per 100,000 people. As you can see, epilepsy isn't confined to one region, but affected every part of the world. But the burden isn't evenly distributed. Countries in sub Saharan Africa, parts of Latin America, and even South Asia often show higher prevalence rates, sometimes exceeding 800 cases per 100,000 people. These regions also tend to face the greatest challenges in assessing diagnosis, treatment, and long term care. Whether it's due to poverty, lack of trained neurologists, or even cultural stigma, millions of people living with epilepsy remain undiagnosed or untreated. And understanding where the burden is highest helps global health professionals prioritize intervention, resources, and even innovation, especially for seizure prediction tools that can be deployed in these high need areas. Now, to understand seizure prediction, we need to understand what an EEG is. EEG stands for an electroencephalogram, a medical test that measures the brain's electrical activity using non-invasive sensors placed on the scalp. Now, these sensors pick up waveforms that reflect the brain's real-time signaling. Neurologists look at these waveforms to identify patterns, especially abnormalities that may indicate a seizure disorder like epilepsy. EEGs are extremely helpful for diagnosing epilepsy, but here's the catch: they don't predict seizures. They only tell us after a seizure has occurred. And because they require clinics, machines, and trained specialists to interpret the data, they aren't always available in lower income or rural regions where the need is often the greatest. And this brings us to one of the biggest challenges in epilepsy care: unpredictability. Traditional EEGs are diagnostic, meaning they're not predictive. That means they confirm epilepsy only after a seizure has already occurred. They don't give patients any warning before the next one actually happens. On top of that, accurate EEG interpretation requires neurologists who are in short supply across many parts of the world. On top of that, there may be only one neurologist for hundreds of thousands of patients. So the question remains, what do we do? There's a critical global need for tools that can alert patients before a seizure begins, and that is where artificial intelligence has the potential to transform care completely. Essentially, specifically deep learning models to be exact, they can start to change the game, particularly convolutional neural networks or CNNs, which can detect subtle patterns in EEG data where human experts often can't see. Now, these EEG signals are complex and noisy, but these models can sift through that noise and find early warning signs. To train these models, researchers feed them thousands and thousands of EEG recordings that are labeled as either normal, preictal, or ictal, which means seizure. And the AI learns to recognize what the brain looks like in the minutes before a seizure begins. Over time, the model can become better at identifying those pre seizure signatures and eventually predict an oncoming seizure with high accuracy, sometimes even several minutes in advance. Some studies have shown over 90% accuracy with fewer false alarms than earlier systems, and this kind of precision gives patients a real window of opportunity, a time to act fast before a seizure starts. And the good news is this technology and innovation isn't just theoretical, yet it's already being used and tested in the real world. At the Mayo Clinic, researchers partnered with IBM to develop a deep learning model that analyzes long-term EEG recordings. Their system has achieved high sensitivity, even in complex clinical environments like ICUs, where brain activity is constantly changing. Meanwhile, companies like BioSerenity are bringing this innovation directly to patients. Their wearable EEG headset connects to a smartphone app, as seen on the right-hand image, sending real-time seizure alerts to users can take action before symptoms even start. It's discreet, portable, and doesn't even require a hospital setting. Even more exciting is that global health pilots are underway in countries like Kenya, India, and Brazil, and these projects use low-cost EEG equipment paired with AI to bring seizure prediction tools to both rural and underserved communities where traditional care is often out of reach. While innovation is advancing, the reality is that millions of people still live without access to epilepsy specialists or EEG clinics. To fill this gap, platforms like tele-EEG have emerged. These systems allow EEG data from both rural or low resource areas to be sent across borders for interpretation by remote neurologists. It's an essential step towards global access, but it's not instantaneous. Results can take hours or even days, and they still depend on human availability. AI offers a fundamentally different approach. Instead of just sending data out and waiting, AI models analyze EEG signals on the spot, providing seizure predictions in real time, no delays, no intermediaries. And this local analysis empowers patient and frontline providers with immediate feedback, even in areas without a single neurologist. This isn't just faster, it's more scalable. This means that communities that were once entirely left out of specialized care can finally access proactive, life saving support on their own terms. In conclusion, epilepsy isn't just a medical condition, it's a global health challenge, and one of its most devastating features is its unpredictability. That uncertainty affects more than health, it affects education, employment, and independence. But thanks to AI enabled seizure prediction, we're entering a new era, one where patients aren't left in the dark, but instead equipped with real time tools that help them anticipate and prepare. Here are my references cited in MLA format. And now I would like to say thank you. First of all, thank you so much for the Global Health Leaders Conference and the team for making all this possible, allowing me to participate and deliver this presentation to you guys. Thank you to my parents for encouraging me to explore my passion in neurology. Thank you to Rishik Ramaneni, a past accepted student speaker, for both his guidance with my research and presentation. And lastly, thank you to you, yes you, the listener, for taking the time to tune into my video. I've attached my email ID and LinkedIn here for anyone who wants to contact me for any purposes related to my research or presentation. Thank you again and have a phenomenal rest of your day.